Today we're getting into something really fundamental, the core philosophical ideas behind osteopathy. We're drawing specifically from the work of Viola M. Fryman, her papers, and, interestingly, unpublished lectures.
Yeah, she was a major figure.
Absolutely. And our mission here isn't just history, it's to really grasp what Andrew Taylor still called his three basic foundation stones. These were ideas that completely shifted how people thought about health compared to, well, the medicine of his time.
And honestly, compared to a lot of medicine today still.
Right. These concepts are still pretty radical in practice.
And what's so valuable about Fryman's perspective, I think, is how she grounds these, sometimes lofty philosophical concepts. She brings them right down to earth into practical, clinical application.
So less vague holism, more.
Mm-hmm.
How does this actually work?
Exactly. It's about seeing these principles in action, understanding how they guide, recognizing the deeper stuff going on with health and illness, real-world application of some pretty profound ideas.
Okay, let's dive into that first one. The first foundational idea, we need to understand what Still was reacting against, right? The sources highlight this tendency in medicine then and now to just focus on the bit that hurts.
Mm-hmm. The area of complaint.
Yeah, the diseased organ, the symptom.
Yeah.
And the approach is basically find the problem, then hit it with something from the outside to counteract it.
It's very much a combat model. Got a headache, here's a chemical to block the pain. Got bacteria, here's an antibiotic to kill it.
Sleeping pills for insomnia, decongestants for congestion. It's all counteraction.
Precisely. The assumption is that the cure, the healing agent, has to come from outside.
So Still's first big idea flips that completely.
Completely. He taught that the body itself possesses this inherent capacity, an innate wisdom for its own healing work. He called it the therapeutic force or potency.
The power is inside.
The healing force is always fundamentally an internal resource. It's already there.
Okay, that sounds simple, but it really changes the role of the practitioner, doesn't it? Cuts the ego down a bit, maybe.
Yeah, maybe.
Like, if I cut my finger, a top surgeon cleans it, stitches it, bandages it perfectly. What part of the healing process can that surgeon absolutely not do?
They can't do the healing, not the actual mending part. They set the stage, clean the wound, align the tissues, remove obstacles.
Right.
But the actual knitting together of the skin, the rebuilding of tissue, that depends entirely on that internal therapeutic force within the patient. If that force isn't working well, if it's blocked or overwhelmed,
healing just doesn't happen properly.
It stalls. Yeah.
So if the body's the real healer, the practitioner becomes less of a hero swooping in.
And more of a skilled facilitator, someone who understands the body's process.
Their job is to tune into that internal force.
Exactly. Recognize it, and then identify and remove whatever's obstructing it. That could be mechanical, circulatory, nervous system stuff, even emotional blocks.
Clear the path for the body to do its thing.
You got it. Fryman uses a great analogy, the law of gravity. Scientists don't just, acknowledge gravity exists.
Right, they have to work within it.
They become so involved with it they can function within its rules, even when those rules change, like in space. It's the same here. Mm-hmm. We have to participate in what's happening inside the body, understand its internal laws, not just try to impose external force.
Okay, that makes sense. Working with the force, not against it, which leads us nicely into the second big idea, doesn't it?
It does. The second foundational principle.
Which is another huge shift. The human being operates as a dynamic, interconnected unit of function.
Yeah, this one immediately challenges any approach that just isolates one organ or the place where the pain is showing up.
Because the symptom isn't the real problem.
It's just the effect. The tip of the iceberg, or as Still apparently called it, the apex of the pyramid.
The apex of the pyramid, I like that.
So if someone comes in with, say, shoulder pain, that pain is just the apex. The cause, the base of that pyramid, might be found way down in the spine or the feet, or maybe even related to the head.
So you have to look beyond the obvious symptom.
To really find the cause, you have to consider how it relates to every other part of the patient. It demands a whole person perspective.
And you can actually feel this connection, right? The sources talk about techniques.
Mm-hmm.
Like putting one hand on the sacrum, that bone at the base of the spine.
Mm-hmm. The tailbone area, essentially.
And the other hand on the head.
Yeah.
And you could detect the kind of rhythmic communication between them.
Yes, a skilled practitioner can. That subtle rhythmic interchange is physical proof of the connection. It's happening all the time.
So what's linking everything? We know about nerves and blood vessels.
Those are crucial systems, definitely. Circulatory, respiratory, lymphatic, nervous, digestive. They all link parts. But the thing that really ties it all together from the deepest structures to the skin,
This must be the fascia.
Ingo, the
Yeah.
fascial system. It's this continuous web of connective tissue. It wraps around and weaves through literally everything, every muscle, organ, nerve, blood vessel.
The union suit analogy Freiman uses.
Exactly like a union suit. It's everywhere. And crucially, this fascial web is the primary field where osteopathic treatment happens. When you work with the fascia, you're influencing the whole system.
Because it's all connected. So a pull or restriction in one spot.
It's going to transmit tension, like a snag in the suit, to other, sometimes distant areas. You can't isolate it.
Which leads directly into the third principle, doesn't it?
Perfectly. The third foundation stone, the interrelationship between structure and function.
Meaning how the body is built affects how it works, and vice versa.
Precisely. If the structure, the anatomy, is compromised, twisted, compressed, restricted, then the function, the physiology of that area and related areas will be altered.
And people like Dr. Louisa Bruns actually mapped this out early on, connecting specific spinal issues, what they called osteopathic lesions.
Yes, she did pioneering work linking those specific segmental strains in the spine to problems in the organs, the viscera.
Can you give an example, like maybe for the heart?
Sure. Let's simplify a bit, but for a functional heart issue, the sources often point to the upper back, specifically the third and fourth thoracic vertebrae, T3 and T4.
Okay, between the shoulder blades, roughly.
Right. If there's a mechanical strain there, like if those joints aren't moving properly, it can create local irritation, maybe some swelling, eventually even tissue tightening or fibrosis.
And that affects the heart, Hal.
Because the sympathetic nerves that help regulate heart function pass right by there. So that structural issue can directly interfere with the nerve signals to the heart. Structure affects function.
But wait, if the body is this dynamic unit, constantly adapting, like you said, and the sources say these isolated spinal lesions, they don't really last on their own for more than seconds before the body compensates. How do you treat something that's always shifting?
That's a really key point and a challenge. The body does adapt immediately. A restriction at T3, T4 doesn't just stay there. It quickly triggers compensatory strains all over the place. Often involving the base of the skull, the cranium, and the base of the spine, the sacrum. So you're not just chasing that one spot.
You treat the whole pattern of compensation.
Exactly. You have to assess and treat the entire pattern the body has adopted in response to the initial problem.
So back to the heart example. You look at T3, T4, sure, but also the head, specifically the temporal bones near the ears. Why there?
Good question. Several reasons. Fascia connects the neck and head structures directly to the chest, the pectoral girdle. Also, a really important nerve, the vagus nerve.
Right, that controls heart rate, digestion.
Huge influence. It passes through an opening near the base of the skull called the jugular foramen, which is right between the temporal bone and the occipital bone. So tension or restriction involving the temporal bone can affect vagal function.
Wow, okay, and the sacrum too.
Yep, because the pelvic diaphragm, the muscles at the base of the pelvis attached to the sacrum, has a functional relationship with the main breathing diaphragm up top.
On which the heart sits.
Right. So tension patterns, link, pelvis, diaphragm, chest, neck, head. It's all one functional unit. You even find acute painful reflex points on the foot related to the cardiac area.
It really is all connected. I love the test Freiman described to show the fascial continuity.
Oh, the toe-moving one.
Yeah. Patients lying down, physician's hands are just lightly on the head. Someone else moves the patient's toes.
And you feel it. You feel that subtle motion transmitted all the way up to the head. Instantly.
Proof of the union suit transmitting tension everywhere.
Absolutely. It demonstrates that you can feel the body's overall tension pattern, what's sometimes called the basilar pattern related to the base of the skull, from almost anywhere on the body, not just by holding the head.
Okay, so we've got the inner healing force, the body as a dynamic unit, and structure-function linkage.
Yeah.
Now let's talk about health itself. The sources argue against just defining health as balance.
Right, because technically we're always in some kind of balance, even if it's a really unhealthy, strained balance, otherwise we just collapse.
Like balancing on one leg versus standing comfortably on two.
Sort of. A better word Freiman suggests is harmony. Health is a state of harmony.
And she uses that fantastic piano analogy.
It's a great one. Imagine pressing the sustain pedal on a piano and hitting all the C notes across all the octaves.
You get this rich, resonant chord harmony.
That's health. Now, keep the pedal down, but change just one of those notes to a B.
Instant disharmony. Dissonance.
Right. And that B note, In music theory, it's called the leading note because your ear immediately feels it pulling, striving.
Towards resolution. Back to C.
Exactly. It wants to resolve.
So how does this relate to a patient? This is where it gets really interesting.
The discomfort, the pain, the structural problem, that is the body's leading note.
It's not just a symptom of damage.
It's an indicator of disharmony, yes.
Yeah.
But it's also showing the direction the body is already striving towards to find resolution to get back to harmony.
So the practitioner needs to listen to that note, follow its direction.
Instead of just trying to silence it, listen to where it wants to go. Help it resolve back to C, back to harmony.
This really pushes us to look for deeper causes, doesn't it? The sources say they're often hidden.
Oh, definitely. Not always the obvious recent injury. It could be something historical, like a fall from childhood that you barely remember, but the tissues do.
Or scar tissue.
Fixed, fibrotic scars from surgery, even years later, can hold significant tension patterns or toxic reactions to drugs. And Freiman puts a lot of emphasis on birth trauma.
The process of being born.
Yes, she considered it potentially one of the most physically traumatic experiences, leaving patterns stored in the tissues right from the start. The body remembers even if the conscious mind doesn't.
And it's not just physical causes either. The structure-function link goes deeper.
Much deeper, into emotions, the mind. What Freiman calls all octaves of energy.
So emotional trauma can cause physical problems.
Absolutely. Think about trauma that involves intense anger or resentment or fear. If those emotions get buried, held onto, the sources suggest they can create a kind of physical resistance in the tissues.
Like holding tension in your shoulders when you're angry.
Exactly, but potentially much deeper and more chronic. That emotional resistance can actually act like a physical block, preventing the body's own therapeutic forces from fully working.
So healing might require addressing the emotion, not just the tissue.
Sometimes, yes, a therapeutic effort might need to be directed towards healing the memory, forgiving the hurt that's sort of embedded in that physical pattern. Until that happens, the physical side might not fully resolve.
That's profound. And this ties into the idea of spiritual health, too.
It does. Freiman draws a parallel. Just like the body needs physical food, protein, fats, vitamins.
The whole person needs nourishment on other levels.
Emotional food, mental food, and yes, spiritual food. She actually states that spiritual starvation, having a neglected or barren inner spiritual life, can be a more serious deficit for total health than a purely nutritional one.
Wow. More serious than malnutrition.
In terms of achieving the highest level of function, the body's optimal therapeutic potential, yes. It's not about religion per se, but about that deeper sense of connection, purpose, coherence. If that's lacking, the structure and function will eventually reflect it.
Okay, so all this complexity, the interconnectedness, the deep causes, what does it mean practically for the physician?
One huge takeaway is the need to just listen. Really listen.
Get out of the way a bit.
Yeah, it's hard, especially when you're trained to jump in and do something. But sometimes the most important thing is to quiet the impulse to fix it immediately and just pay attention to what the patient's own body, their mastermind inside, is revealing through the tissues.
Because the answers are already there.
Often, yes, locked inside the patient's system. Listening helps unlock them.
And this listening facilitates treating the whole person, right? Like the pneumonia example.
Right. Treating pneumonia isn't just about the lungs, although local treatment is important, of course.
You have to look at the bigger picture.
For a full recovery, you need to address the compensatory patterns. That means checking the rib cage mobility, the thoracic spine, how well the diaphragm is moving. That's the main engine of breathing.
And the temporal bones and the pelvis again?
Yes, because of those functional links we talked about affecting the whole respiratory mechanism, looking at the patient in this comprehensive, three-dimensional way.
It makes a difference.
The sources state it makes a significant difference in how quickly people recover and how completely they overcome the illness.
Yeah.
You don't just suppress the symptoms, you improve the overall function.
Which brings up the goal. Is the aim just to get people back to normal?
That's a key distinction. Freiman argues against normal as the goal. Normal just means average, right?
Which can be pretty mediocre.
Exactly. She uses a really stark anecdote, apparently quoting another physician talking about the German SS troops during a purge under Hitler, saying those individuals were perhaps the only truly normal humans in the sense that they were so completely coerced into a rigid physical and emotional role, stripped of individuality, that they couldn't deviate.
That's a chilling way to put it. but it makes the point.
It really highlights the difference. The goal isn't to make everyone average, fit them into a box. The therapeutic objective is restoration to that specific individual's optimum range of function.
What's best for them?
Exactly, which is different for everyone, and it changes throughout life. It's about maximizing their unique potential.
And this structure function thing, it even extends into mental health.
Absolutely. There's research cited showing physical structural components related to mental illness, like specific spinal lesions being correlated with conditions like schizophrenia.
Really, physical structure linked to schizophrenia.
That's what some early osteopathic researchers like Floyd Dunn found, and others, Doctors John and Rachel Woods, observed the cranial rhythmic impulse, that subtle fluid motion in the head. They found it was noticeably slower and more rigid in patients with disturbed consciousness. And interestingly, as treatment helped that impulse become more fluid and active, the patients often showed a corresponding return towards reality.
So the physical mechanics are tied to consciousness itself.
The link seems undeniable. Anatomy is linked to consciousness.
Okay, so wrapping this up, we've journeyed through these three really foundational ideas. The body's own healing power, the fact that we're this dynamic, interconnected unit, and this deep link between structure and function across all levels, physical, emotional, even spiritual.
And the key is, when you really engage with these principles, when that internal therapeutic potency gets switched on and the blocks start clearing, change happens, sometimes in unexpected ways.
Like that story the patient treated for a head injury.
Yeah, complex head injury treatment. And the next day, she starts passing gallstones she'd apparently had for years, completely unrelated symptomatically. Because her whole system started functioning at a higher, more integrated level, it simply couldn't tolerate that blockage anymore and initiated its own cleanup process. The body started healing itself more effectively overall.
A powerful reminder of that innate wisdom. So maybe a final thought for you listening. Consider your own body's leading note.
That chronic ache, that recurring discomfort, maybe even that persistent emotional stress.
Instead of just wishing it would go away or trying to counteract it directly, maybe ask, what deeper harmony, what resolution might that note be striving towards? Because according to these principles, sometimes the biggest block to that powerful self-healing is our own resistance, our fear, or maybe just getting stuck in the story of the symptom.